Hey everyone, it's Dr. Kevin Wafer with Core Chiropractic in the Energy Corridor. And for this week's Ask the Doc segment, we're going to talk about why you may need a leg length x-ray. And the reason why I'm bringing this up this week is this week on Monday morning, I saw a new patient who was from Pennsylvania. And he had seen a chiropractor in Pennsylvania. He had gone through a 3-month treatment plan. He had gotten adjusted. His pain kind of helped, but he really came in with some kind of lower back pain on the left side, which radiated into his buttock area. And he said, the adjustments helped. They took some re-x-rays, but the x-rays looked about the same. And a few months later, his pain started coming back. So while he was here in Houston, he did a search on chiropractors, and he found that we do a specific x-ray that is known as the leg length x-ray. So this is where we take a specific measurement where we take an x-ray at the hips, basically at the top of the bottom of the femur, which is at the top of the knee, the top of the tibia, which is the bottom portion of the knee, and then at the bottom of the tibia, which is the ankle area. What we do is we add the bones of the femur and the tibia together, and this gives us an exact number. That way we can compare the left side to the right side, which tells us if you anatomically have one leg that's naturally longer or shorter than the other. The thing is, I can adjust you all day long, but one of the things I can't do is I can't make one leg grow longer than the other. Now, sometimes you do have what we call a functional leg length issue. That's where if the pelvis is off, it can make it appear like you have one leg that's longer than the other. But by adjusting the pelvis, we can even it out. In a case where you have an anatomical short leg, no amount of adjustment is ever going to get that pelvis properly even. So that was what we found in his case. He had a 9mm leg length discrepancy. We usually want to see 3mm or less. So in this case, we sent him home back to Philadelphia with 2 heel lifts. We start him in a 5mm lift that would go into one of his shoes. This is a way we can gradually start to balance him out. And after a few months, once he started to get used to the heel lift, we bumped him up to a higher one, which is 7mm, which would almost get that pelvis and hips completely level. Now, sometimes in rare occurrences, we do have patients that have extremely large discrepancies. Recently, we had a patient that had a 22mm difference. So this is because she had a tumor in her ankle as a child, and due to the surgeries that they had to do, her legs just grew vastly different. Now, we can only add about 7mm inside the shoe. Anything more than that and really start to put strain into the Achilles. So in cases like this, usually their best option is to go to a shoe hospital and actually have have their shoes and the heel built up to where they can gradually even themselves out. So if you're out there, you've seen a chiropractor, you've gotten adjusted, it helps for a little bit, but it just seems like your pain keeps coming back, it might be that you have a leg length discrepancy. So if you're out there and you think you might have a leg length x-ray, leave a comment in the box. And also I'll leave a link to where you can schedule an appointment in our office here. We'd love to be able to find out if your long-term chronic problem might be due to something simple like just adding a lift into your shoe. So if you have any questions, leave those in the comments. And then, like I said, if you want to schedule an appointment, I'll put the link in the comments as well. Thanks everybody. Have a great rest of the day.